Welcome back. Well, right now we have someone on who's going to tell you about clinical trials. We have Nancy Hook-Said, and I'm going to give you the full name of the company. I put just the initials there. It's called the Center for Information and Study on Clinical Research Participation. That's what this program is organized for, and the actual program is called Aware for All. Nice to meet you.
Nice to meet you too.
So, kind of in a nutshell here, what is this about and what is the purpose of it?
Aware for All is a free program that aims to educate and empower the public in making informed decisions about clinical trials.
Okay.
That having them know that they are not guinea pigs when they're participating, but they're actually heroes.
Mm-hmm. So we hear about clinical trials a lot, and sometimes we see them advertised on TV. We've even had different organizations come on even our show and talk about some clinical trials. And people often have a lot of questions. I think one of the biggest questions is, well, what if I'm really in need of some sort of medication and I'm one of the people giving the placebo? Or in many cases, as you probably know, sometimes they're given their current medication. They don't know which one they're being given, of course. They might be given their current medication versus the new version of it. So sometimes they do feel like, well, gee, is this going to be detrimental to me because over the next 6 weeks, I may not be getting what I really need?
Well, it actually depends on what the drug is and, of course, what they're studying, too. Mm-hmm. Such as oncology, cancer patients, they're not given placebos.
Right.
Okay. And it just depends. Mm-hmm. That they're participating, helping thousands of other people, not just themselves.
Right. And quite often, I understand, they're compensated for this, right? In one form or another.
Yes, they are.
Okay. In fact, we've had people on before that talked about they're compensated sometimes with the actual funds, their stipend.
Yes.
And other times, they are actually compensated by, once they realize this drug is really effective, they may be able to get that drug at a deep discount or even free for another couple years.
That's sometimes what happens at the end of a trial that they participate in, and it goes into an open label, which means they are given the actual medication for a certain amount of time, depending on the medication and depending on what the pharmaceutical company is offering. But it does also help. It helps them in so many different ways. They're helping themselves and so many hundreds and thousands of other people when it comes to these medications. It's always administered under very strict FDA guidelines.
Right.
And our doctors are all excellent regular MDs.
Right.
Certified MDs or DOs. And they're taken very good care of. The FDA watches everything we're doing and make sure that patient safety is number one.
So does this program, and the website is awareforall.org, does this allow people to search out clinical trials throughout the country, or how does this actually work as far as your organization's involvement?
We're given we will be giving out a lot of different ideas on how to contact different sites when they have the health fair here.
Okay.
So this is a free little health fair that is going to make patients aware of what's going on. We're going to have speakers, we'll have little booths, and we'll have free food and coffee, of course, and tea.
Okay. As far as the clinical trials go, are they, let's say someone chooses to do this, are they given a time frame, meaning, well, you're going to be on this trial for the next several weeks, and oh, by the way, you're at the start of this, it's going to take us sometimes, as you know, it might take 2 to 3 years of trials before they figure out and realize this is the drug or technique or whatever it might be. So are they given that information so they know up front the time frame involved? Okay.
They're given every bit of information they'll need.
Okay. And as far as the trials go, are they for different types of medication, or sometimes the trials for different sort of procedures that might be like a new type of stent or something like that?
Those are, yes.
Okay.
We're given the medications, yes, on different diseases and illnesses, and Then there's also, of course, there is for stents or spinal cord stimulation and so on. That there's all different. It just depends on what they're looking for, and we want to make all of them aware of all their possibilities, and that they can be getting care by excellent physicians.
Okay, now if they are currently being treated for something, whatever it might be, obviously they need to first consult their own doctor and physician to see is this whether or not it's going to help them, but their physician needs to know, are they going to be starting something, a different type of medication, or they might actually tell them, at this point in time, we got to keep you on this system that we have. There's a lot of different things. Yeah.
Depends on the patient, but we always get medical records, so we know what they're taking.
Okay.
And then it's compared to with what we will be giving them, so that there's no adverse reactions.
Okay, and then sometimes they may not qualify for whatever reasons.
Absolutely.
Okay. Tell me about the health fair that you're going to be doing here.
The health fair is kind of exciting. We're going to have medical professional speakers, and it's going to be running on November 1st in Clubhouse 5.
Okay.
And it's going to, our speakers, we have a keynote speaker as one of our doctors, and then there's going to be other healthcare participants with little booths and making them aware, and some health screening for them. They'll have blood pressure checks, diabetes testing.
Okay, so it's
food.
Yeah. So on November 1st at Clubhouse 5, do they need to go online to register at awareforall.org?
They can go for awareforall.org.
And I have a phone number there as well. Call that one or not?
Yes.
Or is that that's the number to register?
That is the number to register.
So 617-725-2753. So either one of those, you can go to the website of the phone number.
Yes.
And it's going to be November 1st at Clubhouse 5.
Yes.
What is the time on that?
I believe that's 11 to 2.
Okay. Very good.
Yes, it's very exciting, and we're very excited to be able to bring this event to Laguna Woods, and I think it's going to be very beneficial.
Right. Yeah, I think it will.
To many, many people who need health care, extra health care here and there.
All right, very good. So again, that's Tuesday, November 1st, over at Clubhouse 5 from starting at 11 o'clock. The website is awareforall.org, and the phone number is area code 617-725-2753. So if you want to find out more about this, take a look at it on November 1st. Nancy, thank you very much.
Thank you.
It's a pleasure.
Pleasure to meet you.
All right, bye-bye. We'll be right back.